Now we are going to hear members of the Latino Caucus for Public Health sharing their stories and their vision for Latino Caucus. How did you first become acquainted with the Latino Caucus?
Congratulations to the Latino Caucus in its 50th anniversary. It's been a long time and it's been a great organization during that time. My name is Henry Montez and I've been a member since 1975. This will be my 48th year. The Latino Caucus was somewhat of a toddler. It was about 2 years old when I joined. And I was introduced to the caucus by a good friend and workmate, David Coronado. I had just started working with the U.S. Public Health Service with David and our boss. And David suggested that that year, 1975, I go with him to the APHA meeting and meet the members of the Latino Caucus. And that's how I started out. And
I'm Marilyn Aguirre Molina, and my involvement with the caucus was initially in 1973 when I was a first-year graduate student at the Graduate School of Public Health at Columbia, when my mentor and close friend, Helen Rodriguez-Trias, was adamant that I attend my first APHA meeting. It was being held in San Francisco, California. She was my guide and navigator through that meeting, which I was very happy for because, as we all know, APHA can be one of the most overwhelming experiences possible. But little did I know that such profound public health history was going to be made on November 7th, when Cesar Chavez was scheduled to speak at that meeting. As is legend, by now we know that he was scheduled to speak, but instead of being offered a large plenary session that was worthy of his stature, he was relegated to a small concurrent session in a small room that just was to overflow audience and that we just couldn't fit in, and just overflowed into the hallways.
It's my honor to have been in at the very beginning of the development of the Latino Caucus. Although it started in the early 70s with Cinco Gatos, I came in probably in mid-70 when I was starting my PhD and going through my PhD program. At that time, I believe that I was introduced to the Latino Caucus through Marilyn Aguirre and Carlos Molina at that time, and it was a fledgling caucus. It was just beginning. There was a lot of enthusiasm from those of us, those young first generation graduates of PhD programs in the mid to late 70s. At that time, I met Fernando Treviño, Leo Chavez, and worked with the Molinas. And the first thing they asked me was for a paper on women's health. And they also identified Sandra Salazar from Berkeley or Sacramento. I went to meet with her, and at that time I met David Hayes Bautista, George Flores, and others who were actively involved in the caucus.
Compañeros y compañeras, bienvenidos. Mi nombre es Carlos Molina. Well, my introduction to the Latino Caucus es una novela de amor. As fate would have it, a month prior to the 1976 APHA conference in Miami Beach, Marilyn Aguirre Molina and I got married. Since we were both fresh out of grad school at the time, we could not afford both a honeymoon in Paris and attend the APHA conference just weeks away. Since my bride was one of the founders of the Latino Caucus, but only 3 years earlier, we chose to honeymoon at APHA, and this was actually my first APHA convention. Naturally, I was plunged into the inner workings of the Latino Caucus immediately. So one might say that I took my vows to my bride and to the Latino Caucus at the same time.
Hello, my name is Diana Bonta. My first attendance at American Public Health Association was in 1978. I had my 2-week-old baby girl with me at the time. I was working with the California Health Services Corps to ensure that we were able to recruit Latino and Latina doctors, nurses, and administrators to work in community clinics throughout California, and particularly in farm worker areas. So over the next 45 years, there were very few meetings of APHA that were occurring in Los Angeles. So I was always traveling, usually to the East Coast, to attend a meeting. But the Latino Caucus was the home away from home. I met so many friends and colleagues over the years at these APHA meetings, but it was by attending the Latino Caucus that I was able to really share some of my work and the work of colleagues to see what was happening in all parts of the country and for all different Latino populations. As we well know, we are united, but we are different in so many, many ways. We had, many of us, experiences as the first generation born to immigrant parents. And we shared a passion for community, a passion for la gente, for making a difference. And throughout the ups and downs of our professional lives, and certainly of our personal lives, having people that you could share this with was tremendous. And it made all the difference, I know, for me and for so many others. I had many mentors, and over the years I was able to mentor as well.
Hello, my name is Aida Giacello, and I'm with the Northwestern University College of Medicine. I'm a research faculty there. And I got involved with the APHA Latino Caucus in late 1970s. At that time, I was a PhD student in sociology, specializing in Latino health, also at the University of Chicago. And I was encouraged to present my research finding at the Latino Caucus annual meeting. Eventually, through my participation in the caucus, I became a representative of the Midwest region of the United States, and eventually one of the presidents of the Latino Caucus during the early 1980s. In my journey throughout the years, I met through the Latino Caucus an impressive group of public health leaders. They were activists and worked in diverse fields. They included individuals like Dr. Helen Rodriguez-Tria, Henry Monte, Hortensia Amaro, Ruth Zambrana, Marilyn Aguirre Molina, Carlos Molina, Diana Monta, Greta Ladera, and many others. They really provided their friendship, their support, nurtured me throughout the process through my research career, and eventually became close friends.
Hola, colegas de Latino Caucus for Public Health. I'm Alvaro Garza, retired public health physician and health officer, and I have a few remarks to share. I joined Latino Caucus during the first APHA meeting I attended in 1984, 39 years. It has been my public health home, y familia, and I love it.
Hi, I'm Lisa Maldonado. I live in Brooklyn, and I've been a member of the Latino Caucus since 1995. When I was a grad student, I did some field work in Mexico for a summer for one of my classes. And as part of the class requirements, we had to all submit abstracts to APHA. Mine actually got accepted for a panel, and I ended up going to the APHA meeting in San Diego. I remember being so overwhelmed. The meeting was huge. I had no idea how to navigate it. My friend Sandra Echeverria, she was in grad school with me, and she's now a professor at UNC. She dragged me to the Helen Rodriguez-Tria's breakfast. We didn't have any tickets, but she told me it was okay, it was all right, that we could crash the event. And honestly, it felt like they were kind of expecting us. There were chairs lining the whole meeting room where crashers like us could sit. We listened to the presentation and we snuck some of the food. And then Helen invited all of us to introduce ourselves, like every single person in the room.
I first became acquainted with the Latino Caucus in 1996. I was the Edward Roybal Public Health Fellow, sponsored by the Congressional Hispanic Caucus Institute, and I had accepted a placement in the Office of Disease Prevention and Health Promotion at the U.S. Department of Health and Human Services. So I was working on Healthy People 2000, specifically the Hispanic American Progress Review. Our Healthy People team was presenting at APHA at the conference in New York City that year. And I was invited to go to the conference with the team. And at the conference, my ODPHP colleagues ran into Henry Montes, a former ODPHP staffer. And so Henry and I got to talk. And then I shared my experience and how I came into ODPHP. And he said, I really want to introduce you to the Latino Caucus. So he took me by the hand, really, and walked me over to the Latino for Public Health Caucus booth. And at that moment, there were several officers and members there who made me feel very welcome. I immediately paid my membership dues and started my awareness and acquaintance and later in leadership with the Latino Caucus. And actually 2 years later, I joined Dr. Ruth Zambrana, one of the caucus founders, and she was chairing the Latino Caucus 25th anniversary planning committee. So I volunteered with her to plan our excellent scientific program and awards program. We had a wonderful program at the Mexican Culture Institute that year in Washington, D.C., celebrating 25 years.
My name is Pietro Aparicio. I am a medical doctor and master in public health. I am very proud to say that I am a member of the Latino Caucus for Public Health, and I have been a member of the caucus for longer than a decade. I have had the honor of serving the caucus as the awards committee chair, treasurer, and president. I first came across the Latino Caucus in my third year of attendance at APHA. I enjoyed attending the APHA annual meetings. I learned a lot and connected with many other public health professionals, which was always exciting. However, one year, I noticed the Latino Caucus booth at the exhibition hall. I approached them. Everyone was very welcoming and friendly.
Hola, Patricia Document from the University of Pittsburgh. Back in 2002, when I first went to APHA, I felt completely lost. Yes, I had my presentation and there were excellent sessions, but I did not belong. Then I saw Latino Caucus business meeting, so I went. I met Alberto Cardelle, Lisa Maldonado, Miriam Granton, now Miriam Jardine, and I found these people shared my views, my concerns for the community, and mi cultura. Everything changed, and now I wanted to come to APHA, where I belong, every year.
Buenos dias from Madrid. My name is Jose Ramon Fernandez Peña, and I'm very happy to be here with an opportunity to share with you my experiences with the caucus. I first became acquainted with the caucus in 1990 at the New York City meeting when a friend of mine was presenting, and he invited me to come along. After his presentation, at some point we went to the business meeting of the caucus, and I became aware of its existence, but I never came back to APHA until 1999 when I presented for the first time at the meeting in Chicago. At that time, accompanied by my dear friend Zoe Clayson, I came to the caucus, I came to the breakfast, I came to the business meeting. I got to meet Henry Montes, Helen Rodriguez-Trias, and other individuals that immediately made me feel welcome and wanted me to become active in the caucus. And that's when I really began getting involved, at least in attending meetings and finding out what the caucus was doing or not doing.
Hi, my name is Brenda Lee Rodriguez, and I am Senior Engagement Officer at PCORI, the Patient-Centered Outcomes Research Institute in Washington, D.C. It was actually a referral from a then and current member, Miriam Jardine, and leadership. It was at an APHA meeting years back. And she got me involved with the group. She got me volunteering at the booth. making connections, also reviewing applications for some scholarships, and coordinating the review process.
Hi, I'm Dr. Ilan Shapiro. I'm the Chief Health Correspondent Medical Affairs Officer for AltaMed, practicing physician in the community of LA County and also Orange County. I was coming here for my pediatric training and I didn't have a real professional home. I didn't have a network, and I was very involved with public health in Mexico at the national level. I started hearing about H1N1, that was around 2009, and I founded and I heard about the American Public Health Association. And not only that, but there was a Latino area, Latino Caucus, that were gathering a lot of information. And not only that, they were sharing information for the community. And that was the time that I got involved. I found mentors, I found friends, and also amazing experiences of empowerment and transformation.
Hello, I am Carlos Zomera, and I am a scientist at the U.S. Centers for Disease Control and Prevention. I first became acquainted with the APHA Latino Caucus back in 2003. At the time, I was a graduate student getting my PhD, and I traveled to San Francisco to look for a job. I went to the booth and met some colleagues there, and the people from the Latino Caucus booth invited me to the dinner. That night I attended the dinner and met a lot of people. Everybody was very friendly and welcoming, and I'm still friends with the people that I met back in 2003.
Hi, I'm Barbara Vaquero, and I'm a member of the Latino Caucus for Public Health at APHA. I'm a faculty at the School of Public Health at the University of Washington. Congratulations, Latino Caucus, for this amazing celebration. I am excited to be part of this year's events and opportunities to get together. I first became acquainted with the Latino Caucus during my first conference. So as a student, I came to APHA and I found my community with the Latino Caucus. I met students, I met researchers and faculty that I'd been reading about and I wanted to know. And it's a great opportunity to find others that share the same passion for Latino health and that we can create community across the country. Since then, every time that I come back to the conference, I am with the Latino Caucus. That's always my priority because that's my community. And I get to meet new people and I get to see all friends that we have been growing professionally together across the years. And feels really nice to have that safe space where we can share and we can learn from each other and together.
Hello Latino Caucus, happy 50th anniversary. I'm Daniel Lopez Ceballos. I first became acquainted with the Latino Caucus as a doctoral student when attending the 2005 APHA conference.
Good evening, good afternoon, good morning, depending where you are across the globe or in the United States. My name is Irene Martinez and I'm a faculty member at the University of Massachusetts in Amherst. I've been there now for 5 years. I was introduced to the Latino Caucus for Public Health by my colleague and hermana amiga, Barbara Vaquero. She was the scientific co-chair at the time, and she used to select my abstracts for oral presentations in the Latino Caucus program, particularly the program in 2017. That was a really memorable program. I was on it with Jeannie Concha, Alana Lebron, and a few other people. Then she approached me in the fall of 2018, and she asked me to become the co-chair for the scientific committee with her. So I served as scientific co-chair for 3 years between the fall of 2018 and 2021.
Hello, my name is Cynthia Lebron. My first experience with the Latino Caucus was at APHA. I was a maternal and child health section fellow, and part of that fellowship required us working the booth. So it was my first time at APHA. I was overwhelmed by how big it was and how many people were there, and I was just trying to find my footing. And working the booth, I spot the Latino Caucus booth across from mine and went right over and talked to somebody with the biggest personality and so inviting. And we started chatting and come to find out that it was Andrea Jacobo. And we're both from Hialeah. And it was just an instant connection to know that we're from the same place. And we ended up at the same place. And she invited me to go to the social that night. It was in Philadelphia. And my husband and 2-year-olds were with me. I said, can I take them? And she said, of course, bring anybody. And so I went to a bar in Philadelphia with my husband and my 2-year-old, and I met the most amazing people. I ended up meeting Irene and Barbara and Mary, and it felt very fortuitous to be in that moment, in that space. I just fell in love with the Latino Caucus, and I knew I needed to be involved.